Good afternoon. I'm Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College. On Monday, Wednesdays, and Thursdays at 3:30, we deliver a fact-filled 19-minute update on the health and economic impact of COVID-19. This webcast is powered by Aurora WDC. And our special guest today is Pat ROWE, Director of Air Service Development for Mitchell International Airport. We're going to talk to her about the protocols of flying today and the economic impact of air service on the region. But let's start again with our health update with Dr. Raymond.
Thanks, Tim, and good afternoon, everybody. The first slide covers COVID-19 diagnostic testing metrics. And we've administered almost 300 cumulative tests in Wisconsin and nearly 60,000 in Milwaukee, and our capacity continues to grow. We've had about 279,000 negative tests and 19,400 positive tests in Wisconsin for a 6.5% positive rate. We've had 8,206 positive tests in Milwaukee with a 14% positive rate, but that rate appears to be going down over the last few days, and that's actually good news. And the number of tests reported today in Wisconsin also were a new high at 15,968. Remember, the previous high was almost 13,000 reported on May 29th. And our testing capacity is growing now. It's increased to 15,115 per day in Wisconsin, with now 60 laboratories currently testing and 27 planning to test. In terms of positive tests, we had 483 in Wisconsin today at a low of 2.9% positive, and 104 in Milwaukee with a percentage pending, but it appears to be under 10%. And recall that our previous high for daily testing positives in Wisconsin was 733, and in Milwaukee, 477. Next slide, please. This slide covers COVID-19 hospital metrics, and I do need to update the first metric with some data that became available in the last hour. The number of cumulative hospitalizations in Wisconsin are 2,700 with a 13.9% hospitalization rate if you have a positive COVID-19 test. And recall that we had an initial hospitalization rate of almost 30%. So the rate of hospitalizations for people that have COVID-19 positive tests continues to go down. Currently, we have 357 inpatients in Wisconsin hospitals, and that's down significantly from yesterday. We also have 133 in the intensive care units in Wisconsin, and those are down as well. And there are 373 available ICU beds. Interestingly, that capacity of immediately available beds also has decreased somewhat. Our ICU and ventilator capacity, though, are completely adequate. And in terms of PPE, our most critical needs right now are goggles and gowns. Next slide, please. This slide reviews various COVID-19 indicators. We have 616 total deaths in Wisconsin and 287 in Milwaukee, but I believe that there's a reporting lag because I believe there are actually 315 deaths in Milwaukee. And in terms of the percentage breakdown for ethnicity, Black and African Americans have 153 deaths in Wisconsin, or 24.8%, and 126 in Milwaukee, or 43.9%. And those percentages actually appear to be going down, so that bears some watching. In terms of whites, 418 in Wisconsin at 67.9%, and 125 in Milwaukee at 43.6%. And Hispanic and Latinx, 60 in Wisconsin, or 9.7% of the deaths, and 30 in Milwaukee, or 10.5% of the deaths. And please note that the totals exceed 100% due to overlap between the Black and African American and Hispanic and Latin categories. Doubling times for positive tests continue to extend out to 21.1 days in Wisconsin and 22.9 days in Milwaukee. And the growth rates for daily positive tests continue to remain under 3% now at 2.4% in Wisconsin and 2.7% in Milwaukee. And the reproductive number actually has been under 1, both in Wisconsin and in Milwaukee for the last 2 days, currently at 0.93 in Wisconsin and 0.91 in Milwaukee. And that's a trend that we need to watch. Next slide, please. So for Wednesday's What to Watch, I want to just talk briefly about Google SODAR, which is an experimental website that uses an augmented reality to help you socially distance. And it shows a ring of about 2 meters around you, or slightly more than 6 feet. It's currently available if you have an Android phone at sodar.withgoogle.com. And so please check that out. It's not an app, it's a website that's in beta testing phase. Next slide, please. Now, this final slide addresses ongoing questions about whether there's good evidence that social distancing and face coverings actually work. And the slide shows a pictograph summarizing a recent publication in The Lancet by Chu and colleagues, and I do encourage you to take a look at that. This was a meta-analysis of 172 observational studies of COVID-19 and other coronaviruses like SARS and MERS, and some really interesting results. They showed that distancing reduces infection risk by greater than 50% per meter, up to 10 meters. And what that meant was that your risk of contracting COVID-19 decreases from about 13% at less than 1 meter to 3% at a meter, and further diminishes as you go out to between 7 and 10 feet. So I think this is important. What's not shown on this slide here, but they also mentioned in their study, was that face masks also reduced your risk from 17.4% to 3.1%. And even single layer cotton masks reduced your risk, although there was a gradation of risk reduction, with N95 masks being the most efficient, greater than surgical masks, greater than multi-layer cotton masks, and then finally single layer cotton masks. So the point I want to make is single layer cotton masks actually reduced your risk of getting an infection from COVID-19. And goggles and face shields decreased the risk from 16.5 to 5.5%. So the conclusions from this study, and I think they're very important, are that physical and social distancing, goggles, and face coverings do reduce your risk of COVID-19 infection. So with that, I'd like to thank you and turn it back over to Tim.
Yeah, Dr. Raymond, just a quick question as we bring Pat ROWE in here for our discussion on air service. You talked about R value, the reproductive nature of COVID, and you set that benchmark at 1, and it looks like for 2 days we've been below it. Is that good news?
It could be good news, Tim. One thing we need to be careful of, though, is this is a 7-day trend. And we have to remember that between Thursday and Saturday of last week, we had our 3 highest days ever, over 1,700 reported cases. And we had very few cases reported over the weekend, and we saw a pretty significant uptick in reported cases today. So I'd like to watch this as we go through the week. I think the numbers that we get on Friday are going to be, or Thursday or Friday, will be the most important ones that we have during the week.
And the other point you made was the kind of differing impact that's COVID has had on different parts of our community, particularly African American and Hispanic community. And just kind of a comment on that, because if I have my numbers right, 27% of Milwaukee County's population is African American, yet they are accounting for 44% of the COVID deaths. Mm-hmm. What's the attribution to that much higher death rate there?
We don't know for sure, but we think that many of the issues that are relevant to overall health that don't have anything to do with healthcare, like the social determinants of health, safe housing, good education, nourishing food, safe neighborhoods, may have something to do with the predisposition of minority populations to have disproportionate impact of COVID-19.
Thank you. Patricia ROWE, let's bring Patricia in and talk a little bit about something nobody's done a lot of lately, and that's go to the airport and fly. So Patricia, as people come back to flying, what can we expect at the airport? What's changed from the post-COVID flying to flying with COVID today?
Well, thank you, Tim. The airport has seen an increase in passengers recently, but the majority of those are leisure travelers. People are taking advantage of some very, very good airfares right now. Surveys show us that business travel will gradually increase over the coming months as offices reopen. Right now we have just under 1,000 departing seats a day in June, and based on the airline schedules, we should be at more than 2,000 seats a day by August. Just, some things that corporate travel managers are starting to ask about as their corporate travelers, their sales teams look at returning to the skies. We have a lot of this on the website, the airport website, which is mitchellairport.com. But I can give you a few important bullet points. When we look at most airports, travelers are still going to find a reduced selection of food and beverages. So we do recommend, if people have strict dietary limitations, that they may want to bring their own meal or a snack. And at Milwaukee Airport, on the upside, you'll find some newly opened shops that sell magazines and mints and Spotlight Milwaukee. We've just opened the Bronzeville Crossing and the Summerfest store, which also sell locally made items. One other thing that people are asking about is hand sanitizer. There are hand sanitizer stations in the airport. The TSA is now allowing passengers to bring a bottle of hand sanitizer up to 12 ounces in size through the security checkpoint. So that's quite a bit larger than the normal 3-ounce container size that you're normally allowed. And we do recommend that people plan to have a mask or a face covering readily available to comply with policies that you'll encounter all along the way during your travels.
So Patricia, does the airport, while you're in the airport, require the wearing of a mask? And I presume most airlines do as you fly now.
Our airport does not require them. We recommend them, but there are some airports that require them. So you'll want to have that right available in your carry-on bag because you may change planes at an airport that requires them. Most airlines require face coverings. There are a few that don't, but we have found that for the most part, people, the crews want to be protected as well as you do as a passenger. So they are either required or highly recommended.
Sure. And as the volume's down, what do the lines look like? Are people spaced out 6 feet apart, kind of as they check in and as they go through security?
Yes, and people have learned to do the online check-in. So a lot of people are, if you're just using a carry-on bag, you can check in at home. You can have your boarding pass ready, and you can just come right in and go up to the TSA checkpoint. But yes, everywhere in the airport where people would be inclined to gather is marked out spaces for 6 feet of social distance.
And what is the kind of, you look at air service just in general here, are there fewer flights out of Milwaukee, and what is the volume change between kind of pre and post COVID here?
Well, airports throughout the U.S. Passenger counts were down 90%, even at
Wow,
in the worst times. Yeah, so airlines did significantly cut back on their flights. We do see flights coming back. We do see the advanced schedules for the next few months, and it's really going to be demand driven. Again, airlines they're monitoring people's searches for different places. They're monitoring what people click on, where they're looking to go. And so as they see more and more people being willing to travel, then they are adding flights. I can also say that across the whole travel system, there are some extremely impressive cleaning and sanitizing procedures in place. When you think of air travel, you think, okay, there's the airport and the airline, but on the other end too, there's the rental car, and there's the hotel, and there's the Uber, and all of those industries are doing some really impressive cleaning and sanitizing. So, I mean, I think that people can feel very secure in the travel process and the travel experience.
Good. Let's bring Dr. Raymond back in here and go to questions for both of you. And maybe a final question, Patricia, is it now more important than ever for people if they're going to fly to try and fly out of Mitchell so we can build that service back up?
Well, you know, you hit it right on the head, Tim. Air travel, air service is demand driven. So the single most important thing that we can do in Milwaukee to get our air service thriving and growing is to choose to depart out of Milwaukee Airport. Airlines add flights where people are boarding flights. So if we want our airport to grow, we have to board our flights here.
Makes sense. Chris, questions?
Sure, we had a couple of questions. Pat, you mentioned, I believe, 1,000 seats departing today. What would that number have been either in February or a year ago?
Great question. Well, I'm sorry, but I don't have the exact
No, it's okay. Ballpark.
right on me. So,
But would it have been somewhere 90% greater than that?
well, yeah. Passengers counts are down about 90%. Seat counts somewhat less than that, but yeah, I mean, we're probably at 20% at this point of what we would have had a year ago.
Gotcha. We also were curious about the airport's diversity hiring program. Can you tell us a little bit about that?
Oh, that is a great topic for right now. I just wanted to mention that it is an extremely important initiative. Milwaukee County is the owner and operator of the airport, and racial equity is such an important mission of the county executive, Crowley, and county leaders. And the airport has had for the past 30 years a partnership with the state of Wisconsin called the ACE program, in which 35 Milwaukee Public Schools high schoolers are hired for summer jobs at the airport. And these are hands-on jobs. They learn fueling airplanes, they learn aircraft engine mechanics, they learn airline customer service, they work with the TSA, and so on. So, it obviously is something that the county is very, very pro diversity in terms of all of its holdings, if you will, but certainly at the airport, it's very important.
Great, thank you. Dr. Raymond, we've had some more questions about whether you remain concerned about protesters who may not be observing social distancing or face coverings and all, although we have seen kind of a mix of that, baby, right?
Yeah, well, let me first say that I understand the anger and frustration and the reason why people want to exercise their right to protest. So I'll just say that first. But also we are concerned when anytime that you have people that are mixing and not being able to fully maintain social distancing, and not everybody is wearing a face mask, there's the potential for spread of COVID-19. I think the slide that I showed today illustrates that social distancing and mask wearing is so very important.
We also had a lot of questions about the effectiveness of N95 masks versus a surgical mask. I believe there may have been a recent New York Times story. How would you characterize that? And do hospitals generally have enough N95 masks at this point? Should the general public seek them out at some point?
There still is a shortage of N95 masks for frontline healthcare providers, even with reuse and sterilization of the mask, which we never did before COVID-19. So I'll just start by saying it's courteous to preserve those for people that are in the front lines. And you could argue that first responders and people in high contact industries that come into contact with people that might not be wearing masks should have one. N95 masks are more effective in preventing infections. But as I mentioned, even a cloth face covering, although we're wearing those primarily to protect other people from our respiratory droplets, to provide some level of protection for the person that wears the mask. But N95s are the gold standard.
Great, thank you. And then we did have several questions for Pat about whether the airport considered requiring masks rather than recommending.
Yes, and that's a question that all airports evaluated nationwide. It's difficult to enforce a requirement. It's easier to request that it be done and to request that social distancing be maintained.
Great. Thank you to all three of you, and thanks to everybody who asked a question today.
Good. Dr. Raymond, again, thank you. We'll see you tomorrow at 3:30. Patricia Rowe, thank you very much for an update on the airport, and hope we all get a chance to get back in the air. So have a safe and productive rest of your afternoons. Thank you.
Thanks, Tim. Thanks, Patricia.
Thank you, Dr. Raymond and Tim.